Many of my patients at our functional medicine clinic come in with symptoms of IBS, irritable bowel syndrome. And sometimes it's their main complaint, and other times I uncover IBS symptoms during my routine intake. And we later realize how much it has been driving or accompanying non GI issues like chronic fatigue, low energy, brain fog, joint pain, skin problems, and more. IBS can look different for each person, but the common thread is abdominal discomfort and unpredictable bowel habits, constipation, diarrhea, or mix of both. Statistically, an estimated 5 to 10% of the population is affected, but I believe the real number is higher because many people live with digestive symptoms without ever being formally diagnosed. IBS isn't dangerous, but it can be life altering because it changes how people eat, travel, and plan their day. So, one of the questions I hear most often is, what is the best diet for IBS? In today's video, I'll share with you the new study that might just change how we think about diet and gut health. Welcome back. I'm Dr. Maria Azizian, a board certified general surgeon and an IFM certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So before we delve into the study, let's first define what IBS actually is. It is a condition where the GI system or our gut becomes unusually sensitive, leading to recurrent abdominal pain, bloating, flatulence, and changes in bowel movement, sometimes constipation, sometimes diarrhea, and sometimes both. It is what we call a functional disorder, meaning that even though there is no obvious structural damage to the gut, the way it functions is altered, and that's what drives the symptoms. In this new study published in the Annals of Internal Medicine and Medscape, and the link is in the description of this video, researchers enrolled adults who met that symptom pattern, people whose gut discomfort was consistent and disruptive enough to fit the clinical picture of IBS. And they were then randomly assigned to two dietary approaches to see which would bring greater relief. One group received traditional healthy eating guidance, the kind of balanced advice most of us clinicians give for digestive wellness: regular meals, smaller portions, avoiding irritants like caffeine, alcohol, fried foods, and heavy, high-fat meals. It's not a specific branded diet. It's the classic eat moderately and avoid triggers approach that's often recommended as a first line. The other group followed a Mediterranean style diet, emphasizing fruits, vegetables, legumes, whole grains, fish, and olive oil while limiting red meat and processed foods. After 6 weeks, the results were impressive. About 62% of participants on the Mediterranean diet achieved a meaningful improvement in their IBS symptom severity scores, compared to 42% in the traditional healthy eating group. On average, the Mediterranean group's scores dropped by about 101 points versus 65 points for the standard advice group. So, this wasn't just as good as the Mediterranean diet actually proved superior in reducing IBS symptoms. And that's what makes the study so intriguing, because traditionally most dietary IBS research has focused on something completely different, a much more restrictive approach called the low FODMAP diet. So what is a low FODMAP diet? So the low FODMAP diet has been one of the best studies interventions for IBS. FODMAP stands for fermentable oligo, di, monosaccharides, and polyols, a group of short-chain carbohydrates found in foods like wheat, onions, beans, garlic, apple, and dairy products. In people with IBS, these carbs are poorly absorbed in the small intestine. So when they reach the colon, gut bacteria ferment them, producing gas and short-chain fatty acids that can stretch the intestinal wall and trigger pain, bloating, and changes in gut motility. So by temporarily restricting high FODMAP foods, many patients experience significant relief. However, this diet is complex. time intensive, and socially limiting, and it usually requires the guidance of a trained dietitian to reintroduce food safely and maintain this nutritional balance. And that's why this new Mediterranean diet study is so thought provoking. It actually includes many FODMAP rich foods, legumes, grains, and certain fruits and vegetables. Yet participants still improved. So, how can that be? Researchers believe that the Mediterranean diet may help through other mechanisms: its anti inflammatory effects, its positive influence on the gut microbiome in general, and its impact on the gut-brain axis, reducing visceral hypersensitivity and calming the digestive system overall. As someone from a Mediterranean culture, this way of eating resonates deeply with me because it's not just about nutrients, it's about balance, simplicity, and connection. I grew up at tables where vegetables and fresh greens were always present, served as the first appetizers, not as an afterthought. So, one of the things people often notice when they visit Armenia, my homeland, is just how ever present greens are, such as parsley, cilantro, tarragon, dill. They're all served fresh at every meal, and that is in addition to tomatoes, cucumbers, peppers, etc. And fruit is everywhere, incorporated naturally into daily eating rather than treated as a dessert or a diet food. Another defining part of this lifestyle is also how communal the meals are. Most of the time, dishes are served family style, meant to be shared, and that sense of community, sitting together, talking, taking time, can't help but influence digestion in the most holistic way, in my opinion. You're not just feeding the body, you are calming the nervous system, activating that parasympathetic rest and digest response that modern life often takes away. And this is why Mediterranean way of eating isn't just a diet, it's a rhythm of life that naturally supports gut harmony, emotional balance, and longevity, long before we ever used terms like functional medicine to describe it. So let's put all of this in perspective of this study. Of course, the low FODMAP diet still has strong evidence for symptom relief and remains a valuable tool, especially for those with severe IBS. But because it's restrictive, it's not ideal for everyone. So this study offers another option, one that is easier to follow nutritionally, it's complete, it's sustainable long term. And in addition, the Mediterranean diet also supports heart health, mental well being, and metabolic balance, giving it benefits that reach far beyond the gut. So ideally, of course, there should be a study comparing Mediterranean diet with a low FODMAP diet for IBS. That would be interesting, and it will bring this to another level. From a functional medicine standpoint, IBS isn't a single diagnosis. It's a cluster of overlapping imbalances: gut dysbiosis, low-grade inflammation, altered motility, altered stress responses, and sometimes immune activation, actually frequently immune activation, I would say. And that's why the best diet depends on the individual. My approach is usually personalized based on the patient's current diet patterns and their specific vices, whether that's sweets, chips, or constant snacking. We first work on building a whole food foundation, eliminating or at least severely minimizing those trigger foods. Next, we focus on meal timing, which is extremely important. For many people, eating late at night can be a recipe for a sleepless night and poor digestion, exacerbating or significantly compounding their IBS. In our clinic, we also perform comprehensive gut testing and design personalized protocols based on each patient's results. Additionally, we often offer food sensitivity testing, which can help uncover hidden triggers, including FODMAP related sensitivities. So if you are interested in becoming a patient at our clinic and would like to get to know your gut, you can schedule a 15-minute free discovery call with me to learn more. And the link is in the description of this video. So in conclusion, what is the answer to the question? Is the Mediterranean diet the ultimate answer for IBS? Well, maybe not for everyone, but this study reminds us that sometimes the most effective medicine is also the simplest, because real food that is rich in plants, fiber, and healthy fats can bring come to our gut and balance the body without unnecessary restriction. But of course, I'm hoping for more research. Thank you so much for watching. Please like, share, subscribe. Until next time. Bye-bye.